Hi, good evening, everyone.
Hello.
I am Dr. Sarah Losby,
I'm Mark Losby.
and we're super excited to spend some time with you this evening, sharing with you a bit about the approach that we take to healthcare with our own family, sort of how we got to this point in our lives of having this understanding and this foundation in our health. And sharing with you some key principles on making a choice for your family on how you do healthcare. We titled this talk, which I can throw up here for you.
Yeah, nice slide.
There
you go. There's the fam. Yeah, we've been super excited getting ready for this, and it's, we've been doing health for a living for the last decade or so. And when we think about how do we share our principles, we decided, like, rather than share, hey, take this supplement or do this type of workout, get your chiropractic adjustments or eat this type of way, rather than go through all of that, which we do plenty of that, we're going to spend this evening going through some principles on how we think when we're approaching health, because especially at a time like this, there is a lot of scattered information about health. And the best way to sort through it all is to be able to anchor to some principles for you and your family. So we're going to share 3 of ours tonight that are really have guided us for the last 10 years on how we make decisions about our health. And we hope that, well, you might choose to agree with them, or you might choose that you don't. But part of what we're going to be talking about is you do have a choice.
Yeah, and I think that that's really fundamental when it comes to healthcare. Is many people have forgotten that they have a choice. And during a season of really, let us work ourselves the other way. There we go. During an unprecedented time in history where there's more fear, more uncertainty, people are more scared, we think it's really important that we take a chance to empower ourselves and to equip ourselves to recognize that, man, I do have a say in some of this. So we really want to put some control back in your own hands, not by saying take vitamin C, but by saying, hey, let's think differently. Perhaps there is a different approach to the way that we're doing healthcare that really can give some good benefits. So our goal for tonight is to empower you to recognize your choices, to believe in your choices. And then we're going to give you, like we said, our top 3 for our family, fundamental principles. I feel like it's redundant to say fundamental and then principles.
Yeah.
So top 3 principles upon which we live our lives and the things we're trying to instill into our children. So those can be guiding all of our decision makings, and each little day we don't have to make a new decision and have a new choice. We have these foundational things we believe in, and that can guide every decision moving forward.
So let's dive in. The first thing you're going to be wanting to make note of is, how do you go to the next one? Okay. You do have a choice in your healthcare approach. And a major concept that we want to share is that if you're not aware of that and you don't feel like you're making a choice, like if you're hearing that for the first time, or if you can't explain to somebody else your approach to healthcare in 30 seconds, the truth of the matter is that by you not making a choice, the bad news is somebody has already made that choice for you. We don't want to go too deep into this, but there is a lot of money spent making the choice for you. There are major, huge companies strategizing how to make choices for you in your health. The government's very involved with making choices for your health. Some good, some bad, but there are choices being made about your health. And by you not actively choosing, you're by default choosing convention. And that's a major, major point we want to make tonight, where it's not okay with us having so many people out there or passively choosing convention. Mm-hmm. We're not trying to argue right or wrong, but if you sit down and you do your research and you think and you come up with your principles and you do choose conventional healthcare, that's great. At least you actively chose it. But what we find 9 out of 10 people that are in the conventional healthcare system are there passively, not realizing that they could have made a different choice.
And the ironic part of all of it is that we all have the same goal. Like
Right,
no one's saying anyone wants someone else to be sick. Like
right.
no one benefits by, no one's after someone else's demise. We all have a goal of wanting to be healthy, but what we're recognizing more and more, and particularly in light of all of the current events and recent events that have happened, is that by not actively deciding your belief system on healthcare, deciding how you approach health, deciding how you make decisions, by not choosing that, you do end up with convention. And if you struggle with the concept of walking away or thinking differently than our conventional healthcare system, I would implore you to take any health statistic or outcome that's important to you and research it. And this is like simple to do. Let's just say heart disease runs in your family. Do yourself a favor and do some digging, some Google research on heart disease, and see, is the conventional approach to healthcare in our country working when it comes to heart disease? Look at stats. Are we getting better? Are we getting worse? How much medication do we take? What's our health outcomes? Let's say childhood obesity is important to you. Well, let's look at how convention, what we're doing with our conventional healthcare system, let's look at how that's working to combat childhood obesity
and how it's trending. It's not like it's not like it's bad getting better. It's bad getting worse.
Right. And it's not, you can't argue with me that it's for lack of access to the healthcare system, because when you look at the amounts and the percentage of prescription medications that our country takes compared to other countries, yet how healthy or sick we are as a result of it, it's quite enlightening. We are a fraction of the world's total population. We take the vast majority, over 70% of the world's prescription medications. And I'd be cool with that if we were the healthiest country. But when you look at where we rank against other industrialized and third world countries, we come in with very dismal results in terms of lots of measures of health and longevity and quality of life. And the trends, as Mark said, seem to be only getting worse. And then when you look at how a virus can come along and completely flip our world upside down, and you look at the populations that it's most attacking, which is those that are unhealthy, right. Man, if our healthcare system were working, we wouldn't be in this position. So I really do want to empower you that it's okay to look at our healthcare system and say, I might just use it for what it's supposed to be, which is emergencies, crisis care, and maybe just say, when it comes to things like actual healthcare, I might look at what our system or the system calls alternative, like eating right, exercising, supplements, chiropractic care. And I might actually flip the script and say, that's not necessarily alternative healthcare, that's actual healthcare. And our conventional approach to it, that would be the alternative. Drugs and surgery would be the alternative to healthcare. Yep. So we really want to encourage you that, by not choosing your healthcare model, you really are making the choice to step into convention. And in my research, and I would encourage you to do this own research for yourself, convention might not be working. Yep. So
before you take our word for it, we're going to kind of take you through a story of how we kind of got to our stance on healthcare.
We're going off script.
No.
Okay, go ahead. Oh,
so this is absolutely on script. This is my transition. So we got to this approach of not actively choosing conventional healthcare. And we are going to focus on 3 principles that we use to make decisions for our family's health, for our kids, for ourselves, and anybody who would, come to us for advice, but 3 principles that we use to make decisions. Because truth of the matter is, you can never, who would have ever predicted the situation we would be in right now? That the entire world would come to a halt. We'd be staying home, businesses would be shutting down. If you would have told me this 3 months ago, I would have said, you're crazy. But lo and behold, we're here. Now, you can't have plans for all of the scenarios, but what you can do is you can have principles that help you navigate these scenarios. So even though we didn't know how to respond to, a virus or the next thing that's coming next year, whatever that's going to be, I don't know how exactly we would respond, but I do know we're going to use these principles to make our decisions. So first principle.
Also, that's our sweet little family.
Yeah.
Pull it big.
There's a lot of guests on the screen. That was our beach trip.
Mother's Day.
Yeah.
Dr. Parks, for those of you that know her husband was the photographer. Yeah. But there's Roman, he's 2.5. Levi is pushing 7, and Gwenny just turned 5. So there's our cute little fam. So we want to share with you our 3 principles upon which we build our family's health, starting with principle number 1. This is so obvious to us, but it's that we are created to be healthy. You can, here, there you go. Okay, principle number 1, we are created to be healthy. I think that because trends in healthcare and because sickness and disease has become so common, that while it seems like common sense, like, oh yeah, we're born and we're genetically programmed for health, that all of a sudden, not all of a sudden, but over time, now we're actually becoming programmed or have programmed ourselves to think that, man, we come into this world defective, deficient, in lack, versus understanding we were born and created, and every bit of research supports this. Very, very few diseases are truly genetically based. There are genetic tendencies, but it's about gene expression, which is epigenetics. There's a very small handful of chromosomal defects that like really are like you're programmed differently, but that's like, less than between 1% and 5% of all disease processes. So I feel very confident saying we are genetically programmed for health.
Now it's understandable how we got to this situation, because if you walk around our community and you just take a snapshot, or your kids are walking around observing the community, it is getting more and more normal to be unwell. But that's not how we were designed. Our principle is that we believe we are created to be healthy. We used to use a tagline that God doesn't create junk. Like, he didn't make mistakes when he made you. He didn't make mistakes when he made your kids. Like, we look at our kids saying they are created to be healthy, and their body is created to thrive. It's not falling apart. It's not broken. Yes, lifestyle, we mess it up. Absolutely. And that's what we're going to eventually get to. But it's not by default. If you default to the body is broken, a bunch of parts that need fixing and repair, or you're missing chemicals, or you're missing medications, or whatever that is, that's not true. Your body is created perfectly well, and lifestyle is the only thing separating it from your potential.
Well, really, and the line or word we like to use for it is called interference. So knowing we're default designed and genetically programmed to be healthy, and it's only when we interfere with it through, give a couple examples, nutrition, lack of movement, stress, chemicals, like all of these things like that get in the way, toxicities. And shoot, you can go all the way back to, and it's been a while since I've had a baby, you can go all the way back to the process of pregnancy and labor and delivery. And you can see the very stark contrast on, does the system of healthcare that I am employing for me as a previously pregnant woman, kind of like knock on wood, even just saying that, as a previously pregnant woman, and this system of healthcare that I am bringing a child into, does this system of healthcare honor the belief system and recognition that we were designed and programmed for health? Yeah. And I would contend with the fact that, you pee on a stick and find out you're pregnant, and then you're told you need to go see a doctor because it has to be confirmed through blood work, and then they have to do an ultrasound to identify a heartbeat, and then you have to be seen this number of times, do this many things, have this many diagnostics, and then as you can only have the baby within this certain window because that's when we think it's dangerous outside of that. And it's not to say that there's not a time and place for good, proper testing and not being negligent. And we live in the 21st century. So let's use some of the tools that are available to us. But this is why we chose to have all of our babies using a licensed midwife. We chose to have all of our babies at home with our first. We did end up at the hospital because there were some things we were concerned about, and that was a safe thing for us at the time. The picture that we showed here, hold on. There we go. This is just an example. This was about 20 minutes or 30 minutes after, probably 30 because we actually had her in the bathroom. But this is our second child being born at home, and I'm checking her nervous system from the moment that she was born, because we're created for health. So I'm checking her nervous system is clear, and we move on and we live our life based upon that assumption, versus a baby born in the hospital is one, there's a lot of interventions that can happen leading up to, even just the birth process itself, with Pitocin and epidurals and mom's positioning and mom not being able to move around and all of these things. And, interventions during birth, like forceps and episiotomies. And then the second the baby's born, like within seconds of the baby being born, it needs to have antibiotic ointment rubbed on its eyes and shots before it leaves the hospital, because, it could interact with an IV drug user or get an STD for hepatitis. Like, it's just all based upon, or it's largely based upon fear. And to me, when we looked at, hey, one of our fundamental beliefs is we are created to be healthy, we can honor natural processes with the way the body works, then it made sense. Like, okay, let's from day one of bringing a new child into this world, let's make decisions that align with that belief system. It's not that we think it's a bad thing to have a baby in a hospital. It's just that decision didn't align with our belief system. And we believe we use hospitals and medicine for emergencies, not as a default for healthcare. Which brings us to number 2.
Yeah. So sense principle number 1 is we believe, how do we write it out? We believe that we were born and created healthy. So since our body is intelligent and smart, we also believe that we should be honoring our symptoms. And this one is where you start to see the two paths separate, okay? And this is a funny picture. This is the last time our family got sick. I mean, it wiped us.
It was 18 months ago. Here, let me just make it a little bigger so everyone can see it.
This is funny. I mean, that was all in 12 hours. Like, I'm curled up on the ground.
Yeah.
So bad.
It hit all 5 of us very quickly.
So let me just take a non-health related example on honoring the system. Say you're taking symptom. Yeah. Okay. Sorry. Say you take your car and into the mechanic, and you tell the mechanic, hey, I'm noticing something weird with the car, and the check engine light came on. Could you check it out? Now that would be a symptom. That's a warning signal. That's something's going on with your car. The light comes on. And the mechanic then says, oh, I know just how to fix this, and puts a piece of duct tape over the check engine light and says, there you go. The light's gone. You're good to go. You would never, and that's a ridiculous example because you would never, ever do that to your car. But what are we doing to our bodies? And that is where you start to see the small difference in approaches. Because we believe, and I would implore you to consider this, that your symptoms are your body's warning sign. So for example, say you have acid reflux. This is a really good one, a really simple one because it's common. But say you have acid reflux. What does the majority of Americans in conventional healthcare do when they have acid reflux? You would then take an antacid. So you're producing too much acid. So you take an antacid to neutralize it. It goes away. That's covering up the check engine light, right? So your body's producing too much acid. You take an antacid. It goes away. Well, you never fix the problem. You didn't honor the symptom. You didn't figure out why is your body doing this. So then what your body do? Creates more acid. Because
shocker, it needed it.
Yeah, there's something wrong.
Yeah.
Right?
Yeah.
So then I can't get in the screen here. There you go. So then you create more acid. So then what you might then transition from an over-the-counter. Now you might actually be on prescription medication, neutralizing the acid in your stomach. And it gets worse and worse. It never gets addressed. And then you're dealing with side effects of the medication and you start to spiral. And it was a small difference in decision on do you honor the symptom or not? Do you cover it up or do you fix the cause? And it starts to divide because now you're on a prescription medication dealing with this symptom, dealing with that. Now you're on another medication and now you've worked your way down this path when it really could have been something you could address simply.
And I think it's really like simple to think of. Medicine and the medical approach really does seek to cover symptoms, get symptoms to go away, and it really doesn't do much to identify root cause. and it's simple examples like acid reflux or headaches, and just asking the question, or let's say even high blood pressure. You get diagnosed with high blood pressure. It's time to start asking the question, did I get high blood pressure because I was deficient in blood pressure medication? And the answer is
great question.
No. Like, there's not a disease that anyone has ever been able to name me that was caused by a lack of medication. That's not the cause. You don't get infections because you are deficient in antibiotics. You don't get high cholesterol because you're deficient in anti-cholesterol, in statins. That's not the reason why you develop the disease process in the first place. So while there's a time and place, certainly, to use the medication to buy you time, particularly when you're in a crisis, but then you have to start asking the best questions, which is, now what's my plan to get off this? What's my plan to identify the cause, recognize that symptom was one of two things. It was either my body warning me or my body healing me, and now start there. So in our household, fevers, puking, diarrhea.
That's a good question. So like, this is another really good question and this is what we try and teach our kids. Say your body spikes a fever and your body temperature starts to go up. Is that a good or a bad thing?
It's a great thing.
It's a great thing. That's your body's response. It's heating up its inner core temperature to fight a bacteria or virus. If you were to artificially lower your body's temperature while it was trying to fight something off, that would actually be, and again, there are emergencies and you do want to monitor this closely, but the fever is the body's correct response at the right time. When we're laying on the floor like that, we're not artificially trying to lower any fevers. We're taking care of our bodies. We're staying hydrated. We're monitoring, how well the kids are doing. Again, you're not throwing.
We're not being negligent.
Right. But we actually would prefer them to fight off whatever they're fighting off with that increased temperature. Our dogs. With that increased temperature. And then that helps build their immune system and clears whatever the bacteria or virus was.
So we really think honoring symptoms is a big deal. And we end up down the rabbit hole of medications because typically when we have symptoms, the first thing we do is reach for some sort of either over-the-counter or prescription medication to quickly get rid of the symptom and not stop and ask the more challenging question of what's the root cause and how do I honor the symptom and address the root cause. Honoring symptoms is a really big deal to us. Okay. Point number 3, health is about function, not feeling. Health is about function, not feeling. And this comes straight back to the actual definition of health. You poll 100 people and you say, how do you decide you're healthy or sick? The vast majority of answers you will get is, I decide I'm healthy or sick based upon how I feel. If I don't feel good, I'm sick. It's very reasonable. Here's the problem with that approach to deciding if you're healthy or sick is that you can feel great. Just like my father, who felt great, went out hunting the same morning he had a heart attack. Thank God he lived and learned so much from it. It was a great blessing to all of our family's lives. But he was feeling awesome that morning, enough that he went out hunting when he had a heart attack. You can be feeling very good and have cancer raging through your bodies. And you all can probably think of personal examples that this happened to. So a foundational concept that we build our family's health upon is that health is about how we're functioning, not about how we're feeling. And that guides all of our decisions. That makes it so that when we are in our 20s and 30s, looking good, feeling good, we're still out working out 4 to 5 days a week. We're still eating clean, healthy, nutritious food, 90-10 rule. We're taking our supplements. We get adjusted. 90% of the time, our adjustments are because it's the right thing to do to be healthy, to allow our bodies to heal and express function at its fullest, not because we're in pain. Is it still great to have that as a resource when we throw our back out or have a migraine headache or have numbness and tingling in our hands? Great thing to be able to get adjusted in that season too. But vast majority of all the decision making we do for ourselves and our family is under the notion that health is about how we're functioning. So everything we're doing is about improving how our body functions. And it's not rocket science. Like, we're all built very similarly. Like, most people can follow some basic guidelines that you could Google or follow any of our protocols or read any of our books. There's some pretty foundational things that you can do to be healthy. and recognizing that I do those things day in and day out, not because I'm in crisis, not because I'm overweight, not because I'm in the middle of a disease process, but because I'm doing those things to improve how my body functions, because I understand health is about function, not about feeling. And it's really like enlightening to see that we've lived this lifestyle for the last 15 years. And as our friends have gotten older, we're 37.
36. I'm almost 37.
You're almost 37. He's almost 37. As we've hit our 30s, mid 30s, and moving in towards the 40s, we're seeing the divide happen. Like our friends that like have chosen a different lifestyle, that don't eat right and don't exercise and haven't been taking those proactive approaches, we can see the divide start to happen. And in our 20s, it got hidden, and in our early 30s, it got hidden, but this thing starts to catch up with us. So we're seeing, man, taking care of ourselves, investing in our health on the front end, recognizing it's about function, not about feeling. That's foundational to the approach that we take. That's why we raise our kids the way that we do. That's why we're teaching our kids to work out with us. That's why we're teaching our kids to take supplements with us. That's why our kids are getting adjusted with us. Felt like you wanted to happen.
I do. So again, so the theme of tonight is your healthcare path is your choice, right? And here's another really stark difference in the conventional approach and the chiropractic approach that we're choosing for ourselves. Is a conventional approach would be wait and see. I feel fine. I do my blood work once a year. I do tests, I get checkups. Everything seems fine. It's a sit and wait approach. So it's do nothing, do nothing, do nothing, do nothing. Diagnosis.
Right.
Now fix this diagnosis, right? Again, a slight difference is on this side, this is backwards. On our side, it's invest in your health, invest in your health, invest in your health. I feel fine, but I still eat good. I still work out. Like she said, 90% of the times I get adjusted, I go in to get adjusted. I feel good and I leave feeling better. I meet so many people when we say, they say, what do you do? Oh, we work in a chiropractic clinic. I love chiropractors. Yep. Every time my back hurts, I just go in and they make me feel better. And it's like, that's awesome. Yeah, that's great. And you absolutely can use our offices for that, but it's still on the back side of things. It's not staying in front of it. It's waiting for the pain to show up, fixing the pain and staying on the backside versus I'm constantly investing in how my body's functioning, staying on the front end of it.
And just because we take for granted that people understand the role chiropractic has in function, it's super simple, like anatomy 101 that we all learned in 4th grade. Because we're interested in improving and maintaining how well our body functions, we take care of our nervous system, we take care of our spine, because the job of our spine is to surround and protect our nervous system. Your brain, your spinal cord, your central nervous system control every single function of your body. And we learned this in 4th grade. And it's surrounded and protected by the spine. So just A plus B equals C. If the job of my spine is to surround and protect my central nervous system that controls all healing and all function in my body, then you better believe, if health is about function, not about feeling, that one of the key things I will do for myself and my family, and will go to my grave teaching other people, is that you have to have a healthy spine for you to be healthy. If you need proof of it, go look at people who are in a nursing home and observe their postures. There's evidence right there that as your posture deteriorates, your spine is deteriorating and your health goes right along with it. And there's all the research now on sitting is the new smoking, and hyperkyphosis, the hump in your back, is a predictor of early mortality. It's just basic anatomy that a healthy spine equals a healthy nervous system, which equals a healthy functioning body, which is why we will do it for our entire lives. Our belief system, since health is about function and not feeling, is that to contrast it, to wait until you have a diagnosis to realize you have to take care of yourself, it's a bad idea. And it's expensive, because we'll get that excuse. So it's too expensive to eat organic foods and get chiropractic care and take supplements. We would contend it's way more expensive in time, energy, effort, loss to wait until you have that diagnosis and then be forced to deal with it and potentially not have enough time to get things right. Because health is about function, that's a major principle upon which we live our lives. So your health, your choice.
Yeah. So hopefully this was helpful. We want to wrap with sharing a little bit of our story and how we got here. We didn't always think this way. This isn't like something that was ingrained in us at a young age. This was something that was intervened into our lives, probably in our mid-20s, where somebody came to, she was in school, somebody came to her chiropractic school, Dr. Ben Lerner, and taught her, hey, there is a different way that you can approach your healthcare. And it was like, light bulb. And it wasn't like, boom, okay, now all of a sudden we're running with this and going nuts. It was light bulb.
It was an interruption.
An interruption.
Like, I thought I was going to be a chiropractor to help people with back pain and headaches. I had no idea that people should do chiropractic for a lifestyle and you can take care of kids. Had no clue.
So it was an interruption that changed the way we thought, and more importantly, changed the questions that we were asking ourselves. And hopefully maybe this Facebook video is that interruption that you need, or maybe this is a video that you need to share with somebody in your, maybe you're already rah-rahing us this whole time, saying amen, preach. This might be a video that could be an interruption for your friend or your family member who needs to make an active choice on their healthcare. They might be somebody who's passively choosing convention, and you can see where the story's going.
Mm-hmm. Really, the title of this webinar says it all. When it comes to your health, your family's health, you have to be the one in the driver's seat. You have to recognize that you have a choice on the model of healthcare you choose for your family. If this was a good interruption for you and you're like, I need to figure out more, I like this, but I don't know what my next step is. I'm not local. I just don't know what my next direction is. I'll post some links there, but here it's just another super simple way is shoot me a shoot me a message, a private message on Facebook, contact one of our offices. All of our doctors are doing free virtual health consultations for people around the country. Sign up for one of those. It's a free 15-minute, hey, let's talk about your health and let's talk about what could be some good lifestyle choices to start moving you in the right direction. And then lastly, I'll tell you that you want to find a community that supports this belief system, especially when you're the first one in your family stepping out of convention and stepping into real healthcare. It can be a real big challenge, and you don't have to do that alone. We have a huge network locally and nationally, internationally into Canada that's here to support you. So plug into it. So hope you all enjoyed tonight. Any closing thoughts?
It's great.
Okay.
Comment, share, and shoot us a direct message if you have questions or want more info.
Thanks for joining.
Have a nice evening.